So let's review the pregnancy section and go over some complications of pregnancy and childbirth. And the pregnancy section is located in Chapter 11 of the ICD-9 book. And Chapter 11 codes have sequencing priority over codes from all other chapters, although additional codes may be coded in conjunction with Chapter 11 to further specify any of those conditions. If the provider documents that the pregnancy is incidental to the encounter, the coder would code V22.2 in place of any Chapter 11 code. The provider must document also that a condition that's being treated is not related to a pregnancy. If that documentation does not exist, the coder assumes that the condition is related to the pregnancy, and they would code from Chapter 11. So an example, even if the patient came into the ED and they fell and they broke their foot, normally you probably know it probably isn't related to the pregnancy, but if the physician does not document specifically that broken foot or broken bone is unrelated to the pregnancy, the coder is going to first code from Chapter 11. And Chapter 11 codes are only coded on the maternal record. They are never coded on a newborn record. In ICD-10, the OB chapter possibly has the most changes of all the ICD-10 CM chapters. In I-10, OB is in Chapter 15. Pregnancy incidental to the encounter is classified as Z33.1. And there's a new code, Z3A, which is added to allow for further reporting of gestational weeks on a mother's record. And that code actually at I-10 would be reported on every encounter of that mom. So fifth digits indicate antepartum, postpartum, or that a delivery occurred. And all codes reported that require a fifth digit should have the same fifth digit, except there is an exception to the rule. If a patient delivers during that same admission, complications occur after delivery, so in that postpartum period, the fifth digit would be 2 for that code instead of a 1 on all the other codes for that delivery. In ICD-10, a difference here. There's a final character which is classified as a 7th character, and it indicates the trimester. Not all conditions include codes for all 3 of these trimesters, and the trimester is counted from the first day of the last menstrual period. Now, another big thing in I-10 with the 7th character is the 7th character, as we stated, indicates trimester. So episode of care, as we learned up here from I-9, the antepartum and the postpartum and the delivery, the episode of care is no longer classified in ICD-10. It goes by trimester. So assignment of the 7th character should be based on the provider's documentation of the trimester or the number of weeks. If in the documentation you just see the number of weeks, it's okay. You can use this table and you can go straight to that trimester. You don't have to have the specific trimester documented. In instances when a patient is admitted to the hospital for a complication of pregnancy and it happens during one trimester and they remain in the hospital into a subsequent trimester, the 7th character would be chosen for the trimester that complication occurred, not the trimester at the time of discharge. Routine prenatal visits. So for routine prenatal outpatient visits, when no complications are present, the coder would choose V22.0 and would not be used with any other codes from Chapter 11, same as V22.1. And then V23, supervision of high-risk pregnancy, may be used. This code can be coded and may be used with Chapter 11 codes when appropriate, though, depending on that documentation.